Hello, Life Vantage. This is Darren Jensen coming to you live from our, do we call this Studio B or C? Studio B here at our global headquarters in Salt Lake City, Utah. And it's good to be here with you today on another Facebook Live. Today is part of our doctor series, and we have Dr. Chad Luxenberg with us. We're excited to have him. Before we introduce him and chat with him about our products, as always, we give something away. What do we have, Brady? We've got one of our biohacking shirts that we always give away. Let me see if I can get it up so everybody can see it. If you'd like to get into the drawing for it, please, in the comments section, I already see quite a few of you logging on. And you can do this after we finish too. So anytime that you're watching it within the next week or so, put in just some comments, name, city, state, country, if applicable, and we'll get you into the drawing. And then Brady will draw a name from anybody who made comments, and we'll get you out a shirt. So anyway, as I mentioned, it's great to be with you, and it's always great to have one of our incredible physicians join us on one of our Facebook Lives, because I think they bring a unique perspective to LifeVantage. And today, as I said, we have Dr. Chad Luxenberg. He's a Pro 5 with us out of Florida, and he's an ophthalmologist. And with that, let me just bring him on. Chad, welcome. We're glad to have you on as part of our doctor series. Welcome.
Thank you. It's a great honor to be here.
Well, to get started, let's talk. Let me just ask a general question. People who may not be as familiar with LifeVantage that are watching this video may ask them, what attracted an eye surgeon to join LifeVantage, to become part of the movement and to use the products? What really attracted you as a physician to LifeVantage?
Well, I think it's important to just give you a little background so you know really who's talking to you. So I went to school really from age 5 to age 30, 25 solid years, to learn how to be an eye physician and surgeon. And after that time, I've been in private practice in a solo capacity for 37 years on the west coast of Florida near Clearwater. And it's a real honor to be an eye surgeon, and it's tremendous to take care of people's eyes, even if it's just prescribing glasses to see better, or treating glaucoma, or taking people's cataracts out. But over the past years, I've gotten very frustrated with interference in medicine and in my practice between insurance companies, government regulations, and just, the approach to medicine taking the patient and the doctor away from each other. And I was very frustrated with this and felt that I would just kind of finish out my days till I retired, but not really being fulfilled like I used to be. But then 5 years ago, I found out about LifeVantage, a great company in the forefront of nutrigenomics, which in fact allows me to help people's health and wellness without having to do it in a traditional medical sense. And I really felt that this was a great opportunity. And now I feel like I'm in a much better place, and the future is very bright.
Wow, for 37 years as an ophthalmologist and eye surgeon, that's congratulations. I'm sure you've improved the lives and the health of thousands of people over those years. So thank you for all that you do for that.
That's interesting you say that, and I appreciate your sentiment. Thank you very much. But what I really think is so interesting is that if you get involved in something like LifeVantage, you can multiply your benefits more than just the single person that you're taking care of as a doctor. And I could therefore have a multiplying effect when a lot of people are listening to me, and their health can improve instead of just me being one-on-one in the room saying this will be good for your eyes. So thank you for bringing that up, because it's a very interesting concept.
Yeah, I guess I really hadn't thought of it in that way, that this gives you a chance to really leverage yourself and kind of duplicate out and have a bigger voice and a bigger impact on more people. So very good point. Uh, as you were introducing yourself and some of your history, you mentioned nutrigenomics. And really, for many people, the term nutrigenomics may be something new. Can you talk about nutrigenomics, what it is, and then maybe the importance of it?
Okay, nutrigenomics is the effect on your genetic, not makeup, but your genetic functioning that is produced by taking natural plant materials. In other words, you take a natural herb, for example, and it turns on certain genes that you have in your circuit board. In other words, there are a lot of genes in your cell. They're never all on at the same time, and some may never get turned on. But if you can turn on the right combination of genes to accomplish certain cellular jobs, then you can actually influence the health and wellness of the whole system. And that's what nutrigenomics does. It's more than just eating a healthy diet, it's taking certain plant materials that cause certain groups of genes to be turned on and thereby affect functioning.
Thank you for that. So it's really, I kind of look at it as so we upregulate gene expression or we turn on, I guess, this effect of genes as you were talking about, and it's with natural materials. Is that a new part of science? Because if it's something new, or if most people haven't heard of it, I'm assuming that it's a newer branch of science.
It's a newer branch of science that goes back thousands of years. Isn't that an interesting concept? Think about it. People would know that certain herbs or plants were, quote, healthy for you. And Oriental medicine is based on herbal remedies that go back thousands of years. Perhaps in the Garden of Eden, a lot of these herbal plants were available, and that's why health was such a universal concept. Maybe that's something that goes that far back. But now we're re-evaluating and I guess rediscovering the positive nature of certain herbs and plants. And we are now understanding how they have an effect, whereas in the past we just kind of had a feeling they had a good effect.
I was just over here making a quick note because I thought that was really funny where you said, "Yeah, it's a new branch of science. It's been around for thousands of years now." But it really may be a rediscovery in some way, as you say that we've always had this belief or understanding that certain things helped us, but not really knowing how. And now today, where we can map the genome and we can do it very quickly. I know as we do experimentation here and research at the company, you know, we can we can map the genome of cells and then inoculate it and then map it again to see what it's turned on and turn off. And now we can take these natural uh, plants that had those beneficial effects and combine them synergistically to even give a greater effect. And I'm assuming that's part of nutrigenomics.
Oh, absolutely. And uh, my fiance is always teasing me about, I'm always saying that balance is the most important thing in life. But when we're talking about nutrigenomics and different herbal preparations, the synergy and balance are pretty much everything. You don't want too much. For example, the NRF2 pathway is what has been found to be what is affected by our protandem, the five herbal products, synergistic herbal preparation pill that we recommend and that the company really was founded with. What we find now is that we want balance between the free radicals formed by metabolic systems in the cell, uh, the oxygen based metabolism. So, oxidative metabolism causes production of free radicals, very toxic substances, kind of like the waste materials of a factory that have to be acted on by a waste management system. Then we want to balance that with antioxidants produced by the cell to knock out a sufficient number of free radicals to prevent damage. You can't get rid of all the free radicals, you have to have metabolism, but you want to work on them so they don't damage the cell and cause disease and disorders and dysfunction. So that's the balance part. And the synergy part is the fact that we have five different herbs at low dose that have very little chance of side effects because of their low dose, but when put together in five things in the pill, they cause a tremendous synergistic effect and raise levels of antioxidants tremendously. So it's a great concept having five low dose, non toxic level substances that then have a tremendous effect. And for example, in 2009, a study was done that showed that if you take the five herbs at the same dose that you have in one Protandim NRF2 pill, and you give it separately on the same day, you will have a much less effect on NRF2. As a matter of fact, you have an 1,800% increase in effectiveness with the pill rather than the five substances separately. That's incredible synergy.
I was thinking about that statement, and I mean, this is just a question that popped into my head. So I'm not sure. Well, I'm not sure if I've talked to any of our scientists before about it, but I don't. As in my marketing mind, um, I don't quite understand maybe how this synergy works. Do we know the mechanism? Why would why would taking a smaller dose of a few ingredients together give you, like you said, an 1,800% boost over taking larger amounts of these at separate times during the same day? Do we know what the mechanism
Well,
behind
if
it?
I didn't state that properly, let me correct it.
Okay.
It's the same size or amount of
Okay.
the five substances given separately versus in the same pill. So it's not that you wouldn't have more effect whether you had a larger amount of the substances, but then you have much more chance of side effects and adverse effects directly from it. For example, we have turmeric in Protandim. If you take very high doses of turmeric to get a high antioxidant response, you have a much greater chance that turmeric will have bad side effects. But if you take a small amount of turmeric along with the ashwagandha, along with the bacopa, along with the milk thistle, along with the green tea, then you have much less chance of side effects, and yet you're getting this tremendous effect. For example, after 3 months, on average, the glutathione level goes up 300%. And glutathione is pretty much the most important antioxidant made in the body. So that's a really wonderful thing.
So as we look at the products that are being offered by LifeVantage, and they have a nutrigenomic effect on the body, um, which ones would you always recommend that people are taking, and why, and what makes those important? I know that you've already described some of like the Nerf 2 and the antioxidant potential, but what would you be taking? What would you recommend people take?
Well, I take more than the minimum, but I think the average person who's interested in their health and wellness and would like to do it in a natural way can really uh, rely on just our Vitality Stack, which is a omega 3 and 7 product, a fish oil product. That's one. A probiotic, which also has Wellmune, which kind of balances out your immune response, as well as having the good bacteria added to the intestinal tract. And then Protandim NRF2, which we talked about a little bit, and Protandim NRF1. Now, these things all work together, and they are very, very beneficial for your overall body functioning. The omega 3 and 7 are needed to balance the omega 6 in our diets. Otherwise, omega 6 can cause inflammation. The omega 3 and 7 are good for heart health, circulatory health, and brain health. You also have the Protandim NRF2, which causes a good response to the production of free radicals and makes enough antioxidants to balance that. It also tends to turn on genes that are anti-inflammatory and decrease scarring. Inflammation is a big part of disorders, dysfunctions, disease processes. Although we know that none of these products are designed to or can treat or cure or even improve disease process. Not what we're talking about. We're talking about natural, normal functioning of cellular systems. So if you put the Vitality Stack, which is the fish oil, the probiotic, the Nerf 2 and the Nerf 1 together, and you just take that every day, I think you have a huge leg up on natural health and wellness. And you can pretty much rely on that. And then you can add things to that from the company or other sources that are specifically good for you or you're interested in. But if you take that as a minimum, you are really way ahead of the game. And I really haven't described what Nerf 1 does. It improves the functioning of mitochondria, which is the powerhouse of the cell. It also increases the number of mitochondria in our cells. Now, for example, muscle and brain tissue have a huge number of mitochondria because they use a huge percentage of the energy produced by the body. So if you get more mitochondria in your nerve cells and in your muscle cells, and they work more effectively, you've got a real advantage. Now, when you do that with more mitochondria and more metabolism, the energy level goes up, but the free radicals go up too. But don't worry, you are also on NRF2. So now you're taking care of the increased free radicals with increased antioxidants. So everything balances out, everything works well, and it's just a really great system.
Wow, thank you for encapsulating the Vitality Stack. I know that, a year and a half ago, we used to sell them all separately, and now we've been able to combine them into sachets that are very convenient to carry those around. Whenever I travel, I, take some of those out, throw them inside of my suitcase, and they're perfect and convenient to use through the day. So, well, as we have very limited time, is there anything else, any other key pieces of wisdom or of information that you would like to share before we end up?
Well, I just think that people should look into and do their own research on the real theories about what causes the body to slow down, age, and disorders to develop over time. If you can address those things, you can have a healthier and more beneficial life. And a lot of the theory behind neurodegeneration is dysfunction of mitochondria. It's very important in health to have well functioning and healthy mitochondria. If you understand that the imbalance between free radicals and antioxidants are the nature or the true nature of aging, and you know that aging can be addressed with getting that balance back, then you really are doing a real service to yourself in terms of not just the length of your life, but also the health that you have along the way. In other words, you want lifespan to increase, but you also want the health span to go with it. You don't want to be older and dysfunctional, not be able to do what you want to do. You want to improve your health span and your lifespan. And I think that these products make that very possible. And you can add other things too. We don't have time to get into all of it, but I personally take the fat burner every day, which I think is a great thing for your digestive system. And I also drink an Axio every morning because it gives me a mental boost, and I think it's very safe but very healthy, and much better than taking a high caffeinated energy drink that could be bad for you. So there's a lot of things. I mean, I actually take the skin system too. So you're talking to somebody who's a true believer, and I'm using many of the products, and I really believe in all of them.
All I know is if I had somebody operating on my eyes, I'd want them to be sharp and not having a lot of caffeine where they might be a little jittery. So definitely, I'm glad that you're taking the Axio too. Well, Dr. Luxenberg, thank you for taking the time out of your busy schedule. I know that typically we do these Facebook Lives earlier in the day, but you're a practicing physician, seeing patients, doing surgeries. And so we did a little bit later after your practice and your patients were done for the day. So really, thank you from the bottom of our hearts for taking the time out of your busy day to share some of your experiences and knowledge with everyone who listens.
Thank you very much. As I said, it's an honor to be on and to be asked to do these things. And I would be happy to continue in the future. And I want to wish everybody good luck and you can never go wrong the more you get involved with LifeVantage, both products and the company. It's a great company and the products are amazing.
I agree. So for everyone out there, thank you for joining us today. And we look forward to seeing you on our next Facebook Live. And for Dr. Luxenberg, if you could just hold here on the line for a minute, I'll talk to you as soon as I end the broadcast. But from all of us here in Salt Lake, we'll see you later. Bye.